You can't make real clinical decisions from images between visits. You always need to see the patients in the chair, right? Let's explore the data. A multi-center study published in 2025 in the JWFO evaluated the validity and reliability of the photo sets generated by DM scans. The investigators analyzed 1,040 clinical assessments and compared 5 metrics: caries, attachments, buttons, brackets, and self-ligating clips. Here's what they found. Across all 1,040 evaluations, the agreement between the DM scans and the in-chair exam was 98.9%. In other words, in almost every case, the clinician reached the same conclusion from the DM images as from seeing the patients in the chair. So, is it true that you always need to see the patients in the chair to make real clinical decisions? False. Clinicians can reach the same decision from DM images as from the in-chair exam for some findings, enabling remote assessments between visits while keeping chair time for what truly requires it.